is there an ideal way to bring a new patient into your practice? Is there an ideal way to bring a new patient into your practice? I really think is a great topic. Of course, many of you know I run a marketing company and I live and breathe new patients. And what I notice is there are some practices that do an excellent job in bringing in a new patient, and then there are others not as much. And I would say, Gary, you and Life Smiles set the bar on this. How do I know this? Because one of the metrics, I tell all my clients to work on is how many Google reviews you have, especially love letter Google reviews. So if anyone is interested, I don't know the exact count, but I know it's in the 1,000 plus. Few, if you know the count, tell me, Gary. But
we're approaching 1,200 5-star reviews. So
that is,
I mean, we might have topped that. I didn't check it recently, but we may have topped that. But certainly we're proud of that. And most of those come from new patients. Of course, they can come from existing patients, but many of those reviews come from new patients. And it's kind of a cool recognition and testimonial from people that have experienced the care there.
I agree. I think that's the surprising thing about Life Smiles. Most of them, or a lot of those reviews come from people who have just met you once or been to your practice once. So you are doing something magical. And I know you teach this to your clients. And one of the reasons your clients, I know some of the clients you work with have seen their practice grow 20, 30%. And this is part of that secret formula, this new patient experience. Yeah. So I'm so glad you're kind of giving people a glimpse of what that is. I know there's devil is in the details, and that's what you do in your coaching work, but still, it's a good place for people to kind of get a feel for what you do.
Well, and at the minimum, if it just gets our listeners to think about how they're currently handling, their new patient appointments, and they want to start to make some changes to make it more effective, then this episode will be considered a success.
Yes.
So, is there an ideal way to bring a new patient into your practice? The answer to that is no. That I'm going to share some ideas with you. I'm going to share some things that I have a strong belief in, but ultimately you can adapt this to your practice. Now, one of the points that I want to make here is let's talk about what type of new patient. If the patient is experiencing pain, we should get that patient into the practice as soon as possible. So when someone calls and says, I'm experiencing a severe toothache, I haven't slept for the last 3 nights, I'd like to make an appointment. I think the best way to handle that is, first of all, I'm glad you called. You called the right office. I'm sorry you're experiencing pain today. And then we work that patient into the schedule that day to get that patient out of pain. And again, tactically, let me tie it back to a tactic here. I hope you're all doing morning huddles. As a listener to the Thriving Dentist Show podcast, you know how I feel about morning huddles. Huddle yes. Or muddle. We either huddle or we muddle. I don't think our listeners are muddlers. So in the morning huddle, it's useful to identify a morning emergency slot and an afternoon emergency slot. Rather than saying, oh, we always schedule those at noon, whatever, pick the time. Look at your schedule and pick strategically the best time today. And that way, if maybe we said that's 10 o'clock in the morning and the call comes in at 9, we make that emergency appointment at 10 o'clock because we already pre-planned for it. And typically what we're delivering there is palliative treatment. We're getting the patient out of pain. And I do want to state that an emergency patient can be a very good new patient, because if we get them out of pain, Aaron, there's often a great deal of appreciation and gratitude that goes along with that. And typically this is a person that's been neglectful. There's a lot of reasons why you can experience pain, but typically they've been away from the dentist. And it's pretty easy to say, George, imagine the doctor saying this, George, I'm sorry you're experiencing this dental pain today. We're gonna get you out of pain today. But before you leave today, I'd love to talk to you about coming into our practice as a regular patient so we could avoid, these kind of things from happening in the future. Would that be of interest to you? Guess what just about everybody says, Naren? George, would that be of interest to you to avoid these kind of things in the future? Yes, doctor.
Absolutely.
Yes. And you have their attention. And you have their gratitude because you got them out of pain. But we're not really talking about that example here. We're talking about something more like this. The patient calls and says, I'd be a new patient in your practice. I'd like to make an appointment. And I hope your team members are asking, by the way, how did you hear about us? And it might be I just moved to the area. I met my next door neighbor. I asked my next door neighbor for a dental recommendation. They highly recommended you. It might go something like that. Or perhaps equally as common today in 2024, it might be, well, I did what everyone does when they're looking for something. I went to Google and I typed in Google and you were on page one. I took a look at your reviews. I went to your website. Everything looked good to me, and that's why I'm calling. By the way, when that call comes, make sure your team members are not just processing the call and making the appointment. Make sure they don't miss opportunities on that call. For example, there was a missed opportunity I did in my call coaching recently. A caller called, and I listened to the call and I gave some coaching in the office on this. Practice in Florida, near a major Air Force base. And the caller said, and it was the wife, and she called and she said, my husband just got transferred to the base here, and I'd like to make an appointment for myself and my husband. The team member on the phone went straight into making the appointment, and they missed an opportunity. What was the opportunity that was missed? First of all, my name, let's say,
Yeah.
my name is Susan. Who am I speaking with? Oh, my name's Laura. Laura, before I even get to schedule that appointment, please thank your husband from all of us here at the dental office for his service. We appreciate his service. How is Laura going to feel about that comment, Aaron?
She's going to feel, that she has been appreciated. I mean,
And
especially,
recognized.
yeah, exactly. And she's probably making as much sacrifices as he is because of, him being in the
Sure.
military.
But let's thank your husband
Yeah.
for his service.
Yeah.
And then you could say naturally, by the way, let me be the first to welcome you to Florida. We're glad you're here.
Right.
Yeah, and it's those things that are often missed in the calls. But what I'm talking about here is someone that doesn't have an urgency, but they would like to become a patient of record in your practice. How's the best way to do that? Now, let's bring a little bit of practical advice to this, because if you look at how the major institutes, the major restorative institutes, in the country, let's talk about three of them: the Pankey Institute, Spear Education, Kois Center, John Kois and the Kois Center. What they would recommend that you do is you bring the patient in for an appointment that would include a comprehensive doctor exam and records, whatever records you would take. Of course, they could be x-rays, they could be digital panoramic x-rays, they could be a CBCT, they could be imaging, imaging records if we're using CAD-CAM dentistry or we're scanning. That would be the new patient appointment. And I would agree from an intellectual standpoint, that is the best way to bring in a new patient into your practice, by doing a comprehensive doctor exam and getting the records that you need, because then you could schedule them subsequently for a hygiene appointment based on what their needs are. Are they a regular hygiene appointment, or are they periodontally involved? Do we need to schedule a different type of hygiene appointment? There's only one thing wrong with that, in my opinion. And the one thing that's wrong is, think about what the public wants. What do you know more about this than anyone, Aaron? What does a typical new patient want during that first appointment? What is the service that they want?
The typical new patient, I think one of the things they want is to have their tooth cleaned, but it's not 100% of the time, but most of the time.
They want to have their teeth cleaned.
Yeah.
Yeah, they want to have their teeth cleaned. That's what they want. And so if you don't offer that, you're not necessarily giving the caller what the majority of them want in that appointment. Now, I don't think everything we do should be guided by what the patient wants, because oftentimes they don't know what they need, or they don't understand the benefits of that. But I do think if there's a way to combine those activities and give them what they want, for example, we talk with our clients about the idea of developing a remarkable new patient experience that would include three things. It would include the comprehensive doctor exam, the gathering of all the records that are needed, which would include x-rays, photos, digital photos, any technology such as CBCT or scans, and then also a hygiene appointment of some sort. That's going to be a longer appointment to do those things. Typically, we recommend a 2-hour appointment for that. Now, that's a long time, 2 hours, 30 minutes of doctor time in that appointment. But now we're really being thorough with that patient by doing a comprehensive exam, getting the records that we need, and then providing either cleaning or debridement based on the results of the periodontal screening that they have. And we're giving them what they want on that first visit. I think that could be a very useful adaptation to any of you in terms of designing that new patient experience in your practice.